Okay, so we're going to do some blood glucose monitoring, and I'm going to run through it to begin with, and then I'm going to break it down into sections. So I'm going to do a section on how to use finger prickers. I'm going to do a section on how to use the meter and the test strips. I'm going to do a section on how to do the procedure for the assessment that I'm going to do today. But first of all, I'm going to show you how it's done from beginning to end, and I'll talk you through it as we go, just to make sure it's very, very clear. Okay, so before we start doing anything invasive like this, and it is invasive because you're going to be sticking a needle in somebody and drawing blood out of them. It's a very small needle before you worry about it. So the first thing we need to do, roll our sleeves up, prepare ourselves for doing something that is a clinical procedure, really. And that will involve washing your hands. So wash your hands. In normal circumstances, washing hands is fine. No need to wear gloves. But as I'll say on one or two of the other videos, that wearing gloves at the moment is a requirement. So I'm going to do this without gloves on, and the reason is because I'm going to have to test myself to demonstrate you how to do it. So if you're testing somebody else, wear a pair of gloves, but make sure you don't wear gloves instead of washing your hands. Make sure you wash your hands and then wear gloves. Okay, because hand hygiene is really important at the moment, as we all know. Second thing to think about, and well, equal first thing, is preparing your service user for this. Remember, this is something that the service user may find quite causing them a bit of anxiety, especially if they've had a test done before that's caused them pain or made them jump and made them anxious. So your approach needs to be consistent, it needs to be clear, and it needs to seek consent. You can't just go up to somebody and say, I am going to, and you might even struggle with, would you mind if I, or could I, or your approach really needs to be, are you ready for this? We're going to do this together, and that's really important. Share the responsibility, so to speak. So if you've washed your hands, maybe at the same time the service user washes their hands, because it's really important that they wash their hands. It's important that the hands are clean, the fingers are clean, because that's where we're going to be testing. Okay, so we sought consent. We have some consent. If the service user decides that they don't want you to do it, then as we know from medication administration practice, that we don't keep pushing it. What we do is we have a technique that we withdraw and then approach again, or maybe a different person needs to approach. Don't push the issue unless you want to be faced with anxiety and behaviours and so on. So there is a fairly broad window for testing blood glucose. It doesn't have to be done to the second. If it's to be done at 1 o'clock, for instance, then it doesn't have to be done at bang on 1 o'clock, provided it's done. If it's aimed to be done pre-meal, then it's done pre-meal and not left till after a meal, because even if the readings are all normally done pre-meal, you need to consistently keep them pre-meal. Okay, so what we're going to do is there are other videos, as I said, for use of the machine and the test strip, use of finger pricker, and so on. So I'm just going to show you how it's done in real time. So get my finger pricker ready, and I'm going to have cleaned my hand, or the finger I'm going to be using. So the person's finger has been cleaned. Get my finger pricker, my test strip into the machine. Okay, are you ready for me to test your blood? Person is saying yes. Okay, and they're offering me a finger to use. So I'm going to use this one. So again, I'm doing this on myself, so you're going to need to adapt it to doing it on somebody else. Finger pricker has gone in. Now that needs to go in the sharps bin. Blood comes up. Sample is taken. And then gauze is placed on there. Okay. My reading is 5.2. I'm happy with that. I don't need to redo it. If I did need to redo it, I'd have to use a new strip. I dispose of that in the container. And just make sure that the bleeding site stops. If I'm recording that as 5.2, many care homes, many organisations, they use something like this just to determine where their tests have been taken. So in this one, I've taken it from that point there. So let's say we're calling that point, let's say we're calling that L3. So you might record that as L3, blood glucose reading was 5.2. And the time is 15:35. And today's date. Okay, so we've actually recorded it on there, and you can see how that's come about. We can use one of those sites. Still got blood coming out. Look, we can use one of those sites, and we can record it as being the site. So L3, we know that that's where the blood has been taken from the left hand at this point here. L3. Not all care homes do that, but it's good practice to ensure that you're not using the same site. Actually, I'm telling you a lie. It was actually L2, look. There you go. I could prove that, couldn't I? Just by plopping a blob of blood on there. So that was L2. See how easy it is to make a mistake? There we are. Proves it. L2. So that was 5.2 millimoles per litre, which is within a normal range. So we'll be looking at something like 3.5, round about to 5.5, something like that would be a pretty normal range for blood glucose. So this is kind of right in there. If it was wayward, let's say I took that reading, or let's say I took it again a bit later on, and I found it to be 12, something like that. Let's say I did that at 6 o'clock this evening. I would be suspicious of that, because I'd be looking at sort of what's normal for me. So over time, I know what's normal for me. If it's 12 and I'm not well, or I'm showing some signs and symptoms, then even a second test might show the same. If it does, you can be more confident that that's an accurate reading. But it is really important this is done accurately, and it's really important that the skin is clean, so that you're not picking up residue off the skin, and it's dry when you test it as well, so you're not diluting the sample. We want that sample to be as accurate as possible, because we don't really want to be making a call to the out of hours doctors or district nurses or something and saying, oh, the blood glucose is this, and then they'll say to you, have you taken it again? And you say, oh, no, and then they say, oh, okay, we'll come out. And we come out, somebody turns up, tests the blood, tests it again, and finds it to be completely normal. Patients then, or service users, are sitting there wondering what all the fuss is about. So it's really important that we do get an accurate blood glucose reading. Okay.